Hello, I'm Alexander Berler, the Strategic Business Development Director at IHE Catalyst. As IHE Catalyst, we will try to do many things during that week, the most important of which is a new collaboration that we want to establish with Health Data Sweden, trying to create new use cases in digital health in Europe and especially in the Nordic countries, focusing mostly on trying to create standardized approach on dealing with the scope of care plans. How should someone organize care plans in healthcare, especially in the new context, trying to keep the patient outside the hospitals, which means mostly focusing on primary care and not secondary care, trying to have citizens and patients feel more healthy and more concerned about their healthcare. Health Data Sweden will propose and present the results of the current hackathons and the future events they will do. And from our side, we will try to promote what we do, meaning orchestration of interoperability specifications and testing events, and try to be supportive to this initiative so that in their future plans, they could create and work with us to create an interoperability laboratory for their purpose. The scope of this collaboration is to try to create upfront this way of creating this interoperability lab and try to help communities such as Health Data Sweden to advance on one hand or on their planning or creating new pathways in healthcare, but also in helping them align with what the European regulation will do. As IHE Catalyst is providing extensive support in different other European projects, but especially in support of the new European Health Data Space regulation, which is now voted and signed and is valid since March 2026. It's a good period to try also to educate this innovative group of stakeholders to pay attention to what the regulation will demand in the future and give them the potential tools to make their next use cases and the product and pilots and prototypes they're going to use during their processes, so that those are somehow aligned with what the regulation will demand, that those need to be somehow piloted and tested by the different systems until the latest 2031. So it seems that it's far away, but in practice it's very close, especially if we are talking about educating the industry on how to create products and solutions that will be aligned by the regulation, so that those systems will be able to be added to the list of compliant EHR systems in Europe as an EU-based database.